types of colostomy, the topic that we are going to discuss now. Before going into the details of the video, let me outline the content of this video. This video includes definition of colostomy, indications of colostomy, and types of colostomy. The objectives of this video are, at the end of this video, students will be able to discuss the definition of colostomy, list the indications of colostomy, discuss the types of colostomy. Coming to the definition of colostomy, colostomy is a surgical procedure in which an artificial opening is made into the colon on the anterior abdominal wall to permit the escape of feces and flatus, where the opening will be made on the abdomen to bring the colon through the abdominal wall. Let us see the indications for colostomy. Colostomy is usually created for certain congenital defects such as an imperforate anus, which means there will be a blocked or missing anal opening, and certain serious infections like diverticulitis, inflammation of little sacs on the colon, inflammatory bowel diseases, injury to the colon or rectum, partial or complete intestinal or bowel blockage, rectal or colon cancer, wounds or fistulas in the perineum. These are some of the indications where colostomy is created. Let us discuss the various types of colostomy. Colostomy, either it can be a permanent colostomy or the temporary colostomy. The permanent colostomy is the one where the colostomy is made permanently into the abdominal wall, whereas temporary colostomy is done to relieve an obstruction which can be corrected by resection of the bowel or to divert the fecal stream to permit healing of a portion of the bowel. Next, we'll see various types of colostomies based on the location. Based on the location, colostomy can be an ascending colostomy, transverse colostomy, descending colostomy, and sigmoid colostomy. Let us discuss each one in detail. First, we'll see the ascending colostomy. Ascending colostomy, as the term indicates, it is located on the right side of the abdomen. This colostomy will bring out the stool or the discharge, which will be a very liquid and contains many digestive enzymes. Hence, this astomate should be covered with a drainable pouch all the time. Since this colostomy is located in the right half of the colon, only a short portion of colon remains. The stool which comes out of this ascending colon will be very liquid because very little water has been absorbed in the colon. Next, we will see the transverse colon. Transverse colon is in the upper abdomen, either in the middle or toward the right side of the body. This type of colostomy allows stool to exit the colon before it reaches the descending colon. Here, it is important to know that the stool contains digestive enzymes. These enzymes are very irritating, so the nearby skin must be protected with a skin barrier. The discharge which comes out of the transverse colon will be either semi-solid or it is unpredictable. It can be of any pattern. It contains lot of digestive enzymes. So, as I told you earlier, skin protection is very important. A lightweight drainable pouch holds the output and protects the skin from contact with the stool should be worn by the patient all the time. This transverse colostomy, it can be of double-barreled colostomy, which means both loops are open to the abdominal wall. It has two openings, the one on the right side which is the outlet for stool Another one is on the left side, which functions simply as a mucus fistula. Double-barreled colostomy again can be temporary or permanent. Next is the loop colostomy. It is usually a temporary large stoma constructed in the transverse colon where the surgeon pulls the loop of colon onto the abdomen. You can look into the picture to understand how this loop appears. Since there will be two openings, an external supporting device such as a plastic rod, bridge or rubber catheter is temporarily placed under the bowel loop to prevent it from slipping back into the abdominal cavity. Usually, surgeon makes the opening in the bowel and sutures it to the skin of the abdomen in case of loop colostomy. A communicating wall remains between the proximal and the distal bowel. The loop ostomy has two openings through one stoma. There will be only one stoma, but the bowel alone will be made into two openings, where the proximal bowel drains stool and the distal portion drains mucus. Within 7 to 10 days, the surgeon removes the supporting device which is kept between the two openings. Next, we'll see the end colostomy. As the term indicates, end colostomy is made in the large bowel or rectum after removing a portion of the large bowel. Then the remaining large bowel will be brought to the surface of the abdomen to form a stoma, and end colostomy can be temporary or permanent. Here, most of the time, the temporary solution is relevant in situation where the deceased part of the bowel has been removed and remaining part of the bowel needs to rest before the ends are joined together. Whereas in case of permanent end colostomy will be done where it is too risky or not possible to rejoin the two parts of the intestine after removal of the large colon or the rectum. It depends on the situation or condition of the patient. The surgeon will make the decision to make either permanent or the temporary end colostomy. Next is the descending colostomy. It is an opening in the descending part of the colon. The stoma will be located in the lower left hand side of the stomach. The stool which comes out of the stoma will be solid or firm in nature. Next, we'll see the sigmoid colostomy. It is an opening in the sigmoid colon. The stoma will be located in the lower middle part of the stomach. The stool that is drained from the stoma will be of normal consistency because most of the digestion has taken place before the contents reach the sigmoid colon. Discharge may also be secreted from this sigmoid stoma. If you see the discharge that comes out of the descending or the sigmoid colon will resembles like a normal bowel movement. Elimination may occur on a reflex basis as usual the other individuals. Next, we'll see the wet and the dry colostomy. Actually, it is not the different types. These two terms, that is wet and dry colostomy, are used to differentiate between the sides of the opening, where wet colostomy refers to an opening of the right side where the fecal content is liquid. In addition, the term wet colostomy is used for those colostomies through which both urine or feces are excreted because of the transplantation of the uterus into the colon. Whereas dry colostomy usually refers to an opening on the left side of the colon where the fecal content is usually soft and completely formed. This is all about different types of colostomies. To conclude this content, a colostomy is an operation that creates an opening for the colon or large intestine through the abdomen. A colostomy can be a temporary or permanent one. It is usually done after bowel surgery or injury. Most permanent colostomies are end colostomies, while many temporary colostomies bring the side of the colon up to an opening in the abdomen. These are some of the references made to prepare this video. Thank you.